It turns out the top 2% of our 911 system is like the same 15 to 20 people.
These people are calling 100 to 300 times in a year, almost using 911 as a primary care physician.
The Resource Access Program, also known as RAP, redirects those frequent 911 callers to more appropriate medical help.
Most 911 calls or emergency calls might end in a couple minutes. What RAP does is help people for days, weeks, and even sometimes years at a time to help support them so they're not utilizing 911. Our service is needed and utilized by the most vulnerable patients that they don't have access to primary care. And maybe their mental illness, their substance use disorder, their medical conditions are so severe that they can't just call on a phone and make an appointment for themselves.
RAP team members include 5 paramedics, 2 physician assistants, and a case manager from San Diego Fire Department and Falck.
We're finding patients that are using 911 to an excessive amount. So some of them actually do have a lot of medical problems, and that's where we kind of step in and try to get them more medical care for that medical problem.
The RAP team is a lifeline for people who have no other options for getting the care they need.
A good example of this is a patient of ours who had some complications with her heart. She had an arrhythmia. She keeps calling for pain meds, and we were able to get her a surgery, an ablation, to help with that surgery to fix the arrhythmia. We treated her substance use disorder. We treated her severe mental illness. We helped get her rent on autopay. We helped get her an emotional support cat. We helped get her in-home supportive care and transportation so that she was able to live the most autonomous life that she could, and she completely stopped calling 911.
Knowing that there's a team who's going out there to take care of them and to find solutions for these really difficult, hard to manage individuals has actually taken a lot of the stress off, and our entire fire department and all of our medics are grateful to have RAP there because they know I can't solve this problem during a 911 call, but I can refer them to someone who can step in and actually help them.
The RAP team genuinely cares for our most vulnerable community members.
This is the most meaningful work to me, partly because we are the team that has the flexibility, the expertise to treat the untouchables of our society.
Without RAP, there'd probably be 100,000 plus more calls for service in the city of San Diego without a lot of the patients that we've helped in the past that are kind of on their own now. A lot of them would still be on the streets, if not have passed away. I imagine a lot of the patients that we've worked with probably are still alive today because of the stuff we've done with them.
RAP team, if you're watching this, you truly are heroes, and you deserve every award that you can get. Thank you for showing up to work every day, compassionate, caring, and willing to fight and advocate for your patient. You make the city better. You make the world better. Thank you.